Our vision, the College of Dentistry's vision, is to become a dental school of national and perhaps even international distinction. We would accomplish this by strengthening and expanding our research and clinical programs, in particular in the area of oral and head and neck cancer. Our educational programs, both classroom and clinical, are well documented and have very good evidence of outcomes that are excellent. National board scores, clinical exam scores, and things like that. We also have award-winning service learning and outreach programs that extend throughout Nebraska. Our research has grown significantly recently, but our big goal now is to focus and link our cell biology and our cancer research and partner with the College of Medicine, in particular the Department of Otolaryngology, Head and Neck Surgery, and the Eppley Cancer Institute, to become the outstanding oral head and neck cancer research and treatment center in the United States. This would greatly improve the health and quality of life and bring hope for patients suffering from one of the most devastating and disfiguring forms of cancer. Accomplishing this will bring national and international distinction to UNMC and to the College of Dentistry, and that's our dream.
I'd like to imagine a cancer-free Nebraska. I'd like to imagine that over the next few years, the Cancer Center continues to develop its research activities, not only in basic science, but also to expand translational research activities and clinical research activities. We'd also like to imagine that with the growth of the Cancer Center, that we actually will be able to consolidate that into a multidisciplinary cancer research building, which would greatly facilitate the interaction between our basic scientists, our clinical researchers, and our population-based researchers that are needed to do the research in cancer control, prevention, and outreach that we need to become a comprehensive cancer center designation. We also want to continue to develop state-of-the-art technology to support the research enterprise. We recently developed a high-throughput robotic screening facility that could be used to screen the entire genome of cancer cells to explore which genes are important in developing any particular type of cancer and which genes are important for the growth and the metastasis of that cancer cell. So new technologies, expanded research endeavors are the major focus of the Cancer over the next few years.
This has been an extraordinary year of achievement for the College of Medicine. First and foremost has obviously been the Sorrell building, where we've seen adoption of the new techniques, new technologies with regard to simulation. The dramatic increase in terms of building on the campus has reflected it in terms of our focus of research, particularly in the area of basic research, and both in DRC1 and in our new DRC2 laboratories. We anticipate that investigators working within the college will continue to develop and move forward with a variety of new programs. I believe the future is bright for UNMC research. New programs are being developed at a rapid rate, and we are increasingly being recognized on the national and the international scene.
We imagine a future of MMI with expanded research, basic and applied research in neurodevelopment, motor disorders, mental retardation, neurodevelopmental disabilities. One such future thrust at MMI will be the creation of a Center for Rehabilitative Biomechanics. We envision an early childhood development laboratory. It'll be an environment that will be comfortable for young children and their families, and will focus on measuring their motor behavior and measuring their intellectual development. We hope to have an enhanced motion analysis laboratory, which will have a state-of-the-art three-dimensional system that will allow us to even more accurately measure movements such as walking in children. The future program will expand our understanding, both at the basic level and applied level, of development and treatment for motor disorders in children.
In the College of Nursing, as the faculty and I look ahead to an exciting future in the decades to come, we set our sights very high on ventures that will improve health and healthcare for this great state. We see a Center for Nursing Education Excellence in which robotic patients and simulation programs will help relieve by 50% our dependence on clinical agencies for training sites for students. We see a future in which we have centers of research for advancing the science of nursing care. For example, a center for symptom management and palliative care, a research center for health promotion and disease prevention, a research center for the science of chronic care. We look ahead also to clinical practice ventures, projects that will test new ways of caring for patients in order to enhance the safety and improve the quality of care we can provide.
In this 2008-2009 academic year, the College of Pharmacy celebrated 100 years of pharmaceutical education. And today we're recognized as one of the outstanding centers for pharmacy education and research in the world.
We will advance basic and clinical pharmaceutical science through innovation in research.
The discovery of new drugs to treat human diseases, new ways to deliver drugs to the body and specific targets in the body, the understanding of drug behavior in the body, characteristics of absorption and metabolism, and integrating that knowledge with information on the host genetics so that we can select the right drug for the patient and the right dosing regimen. And lastly, a focus on the cost, access, and outcomes of drug therapy. The ultimate measures of success of our research efforts will be through the translation of our basic and clinical science discoveries into patient care. I want our scientists and clinician colleagues at UNMC to know how much we value their partnerships and their collaborations, and that we look forward to strengthening these relationships so that we can advance our mutual interests to discover new drugs, to make drug therapy safer and more effective, and to improve human health.
The school's internal brand or tagline is Together in Health, and when we all moved together last year into Bennett Hall, it gave us a chance to actually literally realize that vision. We think that really is the beginning of a new era in the school. We've developed new interprofessional curriculum for all of our students. We are in the process of developing a new standalone MRI technologist education program, and two of our programs, PA and PT, have plans to increase enrollment over the next few years by 25% to address workforce shortages. With respect to research, we have focused our efforts in two areas, clinical gerontology and patient safety and quality. Related to patient safety and quality, we're already doing work with Nebraska's rural critical access hospitals. And with regard to our clinical gerontology effort, we're going to focus our work around mobility, balance, and wellness treatment and research for the aging population. So the school is definitely moving forward, and we're doing that together.
The College of Public Health will be known for the service activities it provides to the people of Nebraska and to the region, and also for excellence in some of our research streams, particularly in health services research, of a growing field in environmental and occupational health research. And then finally, we'll have very high quality programs and training we do now for a Master in Public Health. We're adding PhDs to that, and we'll be moving into a program in health administration very soon. Coming into an era of healthcare reform like we are now with lots of changes, our college will provide a lot of knowledge about those changes. We also have a commitment to the community, and that commitment is really evident in our programs in biopreparedness and biosecurity. We're thinking of launching new efforts in food safety, which has become a real critical issue in Nebraska as well as the country. And our Center for Reducing Health Disparities is quite active in both North Omaha and South Omaha with community councils. We're also doing similar projects with the Aberdeen tribal region of Native American populations, all of which are designed to help create healthier populations and healthier communities.